Good morning and welcome back to the second hour of LoveBabz Love Talk. As promised, the director of New Haven Health Department, Miss Maritza Bond. Hey, Maritza, how are you?
I'm good. Good morning. It's such a
Good.
pleasure to virtually see you.
Oh, it's nice to see you. How's everything going?
Things are good. Things are good. Just, trying to make sure our city is healthy.
All right, so what should we be concerned about right now? Because I
So,
know I know this respiratory, is it RSV? Like that's a big deal.
it's flu season, RSV, COVID is still in the air. So we are lumping them together with respiratory illnesses. And as you know, we are into the fall and gearing up for winter. And that typically means that we are going to be entering indoors and gathering also for the holidays, right? And
Oh
so
yeah.
as we're gearing up for the holidays, we know that that increases the risk of individuals getting sick. And so just here today with you to talk a little bit about reminding our residents on how they can stay safe and get vaccinated.
So what should we be doing? And who should be doing it?
Right. So we know that our young children are our highest risk, adults over 65, pregnant people, and people with weakened immune systems have the highest risk. But everyone should be getting vaccinated because those of us that are healthy can expose someone in that category that I just stated and can create a risk for someone else, right? And so we want to make sure that we're protecting those at higher risk. And so those of us that are healthy can get vaccinated. I just got my vaccines 2 weeks ago with the mayor at our wellness center, and we are providing them this season at low cost or for free for those that do not have insurance. And so we want to make sure that access is not a barrier. And so not only is our health department offering it, but our community health centers as well as pharmacies are have these available for those that have coverage.
Mm. And so do you suggest that when I make my CVS appointment, should I get all the vaccines? Like should I get the flu and the RSV and the COVID? Should I do all that?
So it is recommended that you can get vaccines simultaneously, but you do want to use discretion about your health conditions. And so people want to be mindful that if they have other things going on, or if they know that they may have a side effect, you can do that. But Dr. White from our assistant superintendent got the flu and COVID vaccine combined, and he was just fine. I saw him at the Black and Hispanic Caucus a few days ago, and as we're dancing, gathered together, he said he had no side effects. Now, mind you, I did, right? So I ended up getting side effects and it knocked me out for, a day and a half. But guess what? Now I'm geared up and protected for the season and I'm ready to be able to ensure that I'm protecting others, although I'm healthy, because we know that in 2023 and the 2024 season, we had over 4,200 hospitalizations
Wow.
in our area alone and nine fatalities. And so, you know, that could have been those individuals that had fatalities is somebody's, mother, brother, cousin, or sister. And so we want to try to avoid as many deaths as possible because that's too many people that we love getting hospitalized and or dying.
So Marissa, are we still seeing people resistant to getting vaccines? Is that still a challenge for people?
So, New Haven was really on top of its game in regards to the first doses of the vaccine when COVID came out. And then it started dwindling down because people, the pandemic was declared no longer an emergency. And it has evolved, right? The virus has evolved, and we have all these new ways to be protected. We have medicine, we have vaccines. And so, and the numbers are currently low, which is really good. So I think that because the visibility is no longer as present in individuals' lives, I think that there is some lax among our residents and my family and friends, right? And so it's important that we get the message out. And that's why I really wanted to be part of your radio show because I know you have an amazing following. You are an amazing woman, and I admire you. And so I was like, I got to get on the air and be able to share the message to make sure that people get the notice and are aware of what's available to them.
Well, you're very kind to say all those nice things, and I appreciate you shepherding us through the pandemic the way that you have. I mean, I think one of the reasons why we were on top of it is because you were on top of it. So,
Tried my best for
no,
sure.
you did a great job. You did a great job. So, do you recommend, Maritza, are people still masking? Should we still be masking in spaces?
So if you are experiencing cold-like symptoms, you definitely want to mask so that you're not exposing other people. And that's really when you should be masking, right? So be conscious about um your symptoms so that you can be respectful of others, right? Because if you may have the sniffles or a slight cough, that still can produce exposure that's unknown. And also just being mindful, like wash your hands because you can kill a lot of germs just doing basic hand washing repeatedly throughout the day and making sure you're using proper measures when you're coughing, like cover your mouth. I mean, cover your covering your mouth appropriately with your arm and also when you're sneezing and coughing, and then also letting fresh air in your home because we are indoors, just allowing fresh air to circulate, checking your air filters in your workplaces. One of the things we do is making sure that in our homes we should be changing filters through the season, and sometimes that gets missed, right? Because it's not one of the things on our priority list when we are weatherizing our homes. And so it's important that you check your filters in your home. I just got mine changed last week, and geared up for it. I think it's also important that when we get sick, that we be mindful, like use your sick time if you have it and try to stay away from others in a large gathering. So if you know you're sick, be mindful of others because it can impact somebody's life in a tremendous way.
You know, Marissa, I grew up, my mother, when I was a kid, periodically throughout winter, she would open windows. She would open the window for a little bit throughout the day, you know. Not like leave them up all day, but she was like, we gotta get some fresh air in the house. Like we need fresh air in the house. I remember her being very, very like we do it in the kitchen and we do it some other parts of the house. And she was like, we have to get fresh air moving through the house. And I grew up doing that, and I in turn do that still. Like when you're locked down in the winter, you need a little, I crack a window a little bit to let some cool air come through.
Right.
Because you're right. You're just indoors and you're trapped indoors with people.
Yep.
Yes, germs
And listen, and,
everywhere.
and listen, our elders have some great wisdom. I mean, we really need to adopt some of those things, historical things that we've learned from our ancestors. I mean, there's a reason why your mom was opening those windows, right? She already knew that without being an expert in public health, right? Like you don't have to have an all these accolades of educational background. It's just being conscious of like, okay, there's no fresh air coming in here. Let's get some fresh air in here so that it can circulate and keep it fresh. Obviously, your heat needs to be on so you're not freezing and getting yourself cold, sick. But yes, and it's important that people also know, like if you have a baby, anyone over 6 months and older, right, can get vaccinated. So it's also important to protect our infants because they are also exposed to so many adults, especially when there's a new bundle of joy entering the family. There's so many adults coming into the space of a child. So it's really, really important that we also think about our babies.
So, Marissa, do you think it's a good idea as we are gathering with our families to just remind folks to get vaccinated or inquire if
Absolutely.
people are vaccinated? Because, it's still a touchy, for some people, it's still like a touchy kind of a thing. And, we want to gather with our family members.
Right.
And, many of us have intergenerational family members, right? Young
Right.
kids and old people and
Yeah.
everything in between.
And I'm always about like, I'm getting ready to have people over for Thanksgiving. So it's like as you're designing your invitations, do a nice little friendly blurb, right? So like if you have sniffles, leave them at home. You know what I mean? Like, and so like just being mindful because you don't want to offend your family and friends, right? I think you want to respect people where they're at that level of comfort until they're ready. So one of the things I try my best to do is meet people where they're at and providing that information. So we have tons of test kits. And so another strategy can be, and listen, New Haven residents, you can call us. We got you. You need some free test kits, we will provide them for you. You can have them in your home. And I do a friendly ask, like get tested if you do have the sniffles so that we can be safe, things like that. And just having a box of masks out next to the entryway so that people can grab it, but you're not forcing it on people
Mm-hmm.
either. And then the hand sanitizers just around your house. And that is also like some ways that you are being supportive, but not by having things that are actionable without throwing it at their, so much in their face.
I like
You
that.
know,
I didn't think about that. That's a good idea. Stack up a few COVID tests and be like, listen, I got these. If you want one, take one. Take it with you. Take it while you're here. I kind of like that idea a lot. Now, hand sanitizers, because a lot of us still carry little hand sanitizers in our bags,
right.
because sometimes you can't get the soap and water the way you would like to. Is that a good idea?
Absolutely. However, you want to make sure that it's over 70%. So sometimes you have people selling hand sanitizers that do not have the full protection to kill bacteria. So you want to
Oh,
make sure that you have, when you're buying those, that it's just at the back, just look quickly and see the percentage of impact that it can have on the use of it. So, that's a little trick that a lot of people often don't know. And so I usually try to like remind people about that as well. But I keep
that's
mine.
very important, Maritza, because
Yes, it is.
I think people don't think about that.
I keep mine. And they have these little even scented ones because if you don't want your hands to smell like alcohol, they got these little I'm not and I mind you, I'm not getting any proceeds, so I'm not really promoting this brand. But like they have some if you want your hands to smell good, they have some with scented as well.
Oh, I like that. So you can just carry it on your person, and if you find yourself, particularly if you go in and out of doors, or you have to
Eating.
touch things, or
Right. Like I'm oftentimes trying to use my elbow to get out of certain doors, but exactly that. And if you're going to be handshaking and we've all gotten into the routine of handshaking and hugging again, hand sanitizer is important, very vital.
oh, I like that. That is such a good reminder. And you know what? You could get the 70% little ones to go in stocking stuffers so people can
That
have
is a,
them.
that is a great gift idea.
I like that. I like that. Okay, so um it's been very warm, Maritza, lately.
I know.
Does that make a difference? Does it help us? Does it hurt us?
So we know not been, weather has no correlation with the illness. We've seen COVID numbers the ramp up in the summer randomly, and then again midwinter. So what is important is to just making sure you're following those precautions and also following some of the notices that go out to the public. So we're always putting out messaging on social media. Oftentimes you'll see the news all talk about it. So just paying attention to what's happening locally in your local news on staying protected and being aware. So if you're doing these precautions though, you should have a good season, especially if you get vaccinated.
Mm. And so how do we support, or how do we help the unhoused and folks who don't have any place to live and probably can't get access to washing their hands on a regular basis? Is there things in place to support those folks?
Absolutely. We have our unhoused department at the city of New Haven. There's lots of partnership with the organizations that work with these communities, and we will provide supplies as needed and as requested. And so I know some of our initiatives at the health department, we even last year, some of our outreach supplies consisted of gloves, hats, and things of that nature to make sure that number one, people are staying warm. As you know, we will activate warming centers on the city's behalf and partner with many faith-based organizations to assist with that effort. So one of the things that we love, love, love as a city is that we cannot do this alone. And so one thing we do in New Haven is we come together as a community to be able to look out for each other. And I love that about New Haven, especially had been raised here and to be back here to serve the city. I love that it's not just a city effort from the city health department, but really it's a citywide community effort. And so for sure, we are supporting in any way that we can those entities that provide those services.
So how did you come to work in the field of health? What was
Right.
your path?
Let me tell you, it was interesting. I was raised in Fairhaven and in the 90s. And as you know, AIDS was very prevalent at that time.
Hmm.
Also, I within a decade of moving from Brooklyn, I was 8 years old when I moved from Brooklyn, New York to Fairhaven with my grandmother who adopted me. She has transitioned since then, and my uncle who helped raise me and I call dad. And within a decade, we saw factories and job employment just not being available in our community. We saw poor housing conditions. We saw drugs overcoming our neighborhood. And I was just very overwhelmed by what was happening in our community and people not having access to quality food, people being sick and not having access to proper health coverage. And I didn't know what that really was like. And I remember one of my high school teachers suggesting that I go to college. And when I went to Southern Connecticut State University for my first degree, my undergrad, I took an introduction to public health with Professor Quinn, who, by the way, was the health director in the city of New Haven at that time.
I know him and his wife Peaches. We've
And
served
his
our
wife,
yeah.
Peaches.
I know them. I used to live in their neighborhood. We were neighbors, and
Oh my
I
God.
served on boards with
So,
her and knew Bill
so
Quinn well.
So guess what? I did a project with them, and my project was to help provide education for those individuals that around HIV and then individuals impacted by AIDS who were homebound. We would deliver meals, and so I took that on and did it beyond my class requirement and declared a major in public health because of them.
Wow, that's
And then
pretty
I came full
impressive.
circle. And then I came full circle and sat because now we moved, but sat at the same desk as Professor Quinn and just truly, truly grateful for him
And so,
and his wife.
you major in public health. You have your master's in public health too. Where'd you do it?
I did it at UConn
Okay.
and with a MPA certificate, Master's in Public Administration certificate, and completing a master's at Yale Divinity School as we speak.
Nice.
I
So
know.
what do you want to do with that?
It's pretty much already, I feel like I'm in my public ministry. It's specializing in social justice. And so social justice is my passion and public health often intersects with theology. And so I just wanted to have like that, I just wanted to have a grounding in that area. I'm very spiritual in my personal life and wanted to make sure that if I'm asked to speak in certain platforms, I had the proper skill sets to be able to do so.
Hmm. Hmm. Hmm.
So most
I
of my
love the
coursework
divinity
has been
school.
around social justice.
I love it. I love the divinity school, and my goal is to apply at some point after I
Oh,
finish.
we should talk
After,
about it. We
yes,
should
we should
talk
talk
about
about it.
it.
I
Yes.
applied a couple of times and I didn't get in, but
Okay.
I'm pursuing law school because I always wanted to do them both. So
It's hard, yeah.
I'm gonna figure it out. But
No, yeah.
I have a call for the for the study of of religion and I don't want to be a pastor or any of that. I just want to study.
Yeah, like
So
I'm
I
not trying to,
understand what you mean. Like you
yes.
just want it's a faith that you want to explore. I get it.
Right.
So.
And this is your ministry, right? You're getting out to the masses and being able to share your platform to so many people. And so, and then tying that with, with what your faith is. And so, but yeah, and I did read your quotes on the other side of prospect in that book. And I was just I remember when I first learned about the book at the divinity school, and I was like, wait a minute, was this approved by the community? And then saw that there were so many different community leaders in the book. And I was like, okay.
That book still haunts me. I think it fuels why I want to be an attorney, because it was such a daunting
Powerful.
story, you
Right.
know.
Right.
So I'm glad that you got a chance to read it because
Yeah.
it is a very uniquely New Haven story.
Right.
So
And
um go ahead.
no, I was gonna say, and in regards to social justice, that's where sort of my focal point is at the health department is really health equity is at the core of our mission, into protecting the well-being of our residents. And I sort of stress that with everyone that on board. So, I have about 100 employees, 8 departments, and I make sure that when people get hired, that I spend about 15 to 30 minutes with them just to sort of reiterate our mission. Although they're not my direct report, but also learn about like our workforce that we're hiring and what made them want to come to work in New Haven, right? And so, because we know that especially around respiratory illnesses, we saw the inequities. We saw the heightened fact of Black and Brown communities being the ones that had the worst health outcomes during COVID. And so it's important that when people are joining our team, they know what our core mission is, and it's centered around health equity.
I wanted to ask you, what did we learn coming through now that the pandemic is not an absolute emergency? What did we learn? And are we prepared? Should we have to uh, enact more measures if another pandemic comes through?
Yeah, for sure. I think there's a couple of things. Number one, our systems still need work. All the different sectors that serve communities, they really need to be making conscious assessments of their measurable outcomes and how they're treating their patients and preparing their workforce around racism and cultural humility around those with different backgrounds. Um, and really why I was inspired to run for office. And we're not going to get into that, but our systems need work. Our
Mhm.
policies are not aligning also with the needs of our community. So when you have a bad policy, it can trickle all the way down to it will trickle down to our residents. And so we need to make sure that we are reassessing old policies and legislation to make sure we're amending and improving upon them, or creating new ones that are going to reduce barriers. And then as far as preparing for the future pandemics, we have a public health coordinator who developed a new platform on inventory and monitoring our inventory to making sure that we are ready for anything in the future. And then also really reinstating drills. So making sure that we are conscious of preparing with the different stakeholders, partners, I should say, that would play a role in responding to any type of emergency that may arise in the city. And so
Mm,
preparing is key.
mm, mm. So I didn't invite you here to talk politics, but I'm sure you've heard about the whole Puerto Rico is
Oh my
uh
goodness. Yes.
and are you of Puerto Rican descent? Are you Puerto Rican?
So yes, so I am Puerto Rican descent. I do not know my father's side of the family, so I do have some Cuban in me, but I was raised by my mom and my grandmother, all Puerto Ricans, and were born in Puerto Rico. I go to Puerto Rico several times a year. So I'm a proud Puerto Rican, and was really disheartening to see those remarks shared, not only around saying what the derogatory remarks that was made, but just also doing acknowledgments of Latinos in the room and then saying blatantly, see, they're entering our country. It was just disheartening. And the fact that Latinos need to wake up and really realize who they support and who's going to be our best choice this election season, because we cannot have someone who is promoting hate and fostering hate representing us.
Mm. Oh, because I have quite a few friends from Puerto Rico, and they were quite wounded by this. Like they
Mhm.
were just wounded by it, and just thought it was just like a slap in their faces. And I'm of the mindset of, yes, be mad, but vote, right? Like
Yeah, be mad and vote. And
be
that's
mad and
exactly
vote.
what people need to do. Please go out and vote, and your voices will be heard. And that's the way, right? And I'm bipartisan. I love individuality. I love people's individual identities. That's what makes us all different and special. But one of the things that's important is that we want to be knowledgeable, and knowledge is power. So before you cast your vote, make sure that you know who you're supporting inside and out, understand their policies and how they align with your true values.
Mm. I think that's a good message as we are 7 days away from choosing a president and down ticket too, right? Like,
And
and
I was
as
going to say across the state.
yes, we are ch choosing leadership. So, is there anything, Maritza, that's a personal project that you'd like to be done in the health department? Like, is there something that you're like, you know what? If I had more resources, I would work on.
I would revamp our maternal and child health section. We do not have funding sources to support that. I belong to the Black Maternal Health Project with in partnership with many organizations. One of the leaders is out of Community Action Agency and working with also Natasha Ray, many other leaders. And we're working that because we're passionate about it, but there's no real funding tied to it because we know that unfortunately Black women are significantly having the highest rates of infant mortality, and regardless of socioeconomic background, regardless of coverage, and that cannot happen. And so that would be something that I would love to reinstate formally and have some funding support so that we can really enhance that initiative.
Mm, mm. And it's on, I'm hearing people talk about this all across the country. But you're right. Money has to be poured into this to really make some inroads into
Right.
eradicating poor Black, not even Black and brown women from dying in
I was gonna say
childbirth.
Black and brown women are dying the highest. Yeah.
Yes. Yeah. And it's across economic lines. It's not just
Right.
poor Black women, it's
Oh no.
affluent Black and brown women.
Absolutely. And that's what we need to address, right? So we know that this is a systemic issue. And so we need to address that. And then the fact that, you know, Black and brown women may want other options, and that's not supported either should not be allowable. The fact is that there is a trust issue that needs to be changed and needs to be addressed. And it goes back to my initial point as that what COVID taught me in responding to the pandemic is that our systems need to do some work and they need to recognize that the work needs to get done so that we can change and move that needle forward. Because until that data and those of us that are data heavy changes, that means that it's not working, right? And so the numbers are not moving. And in many areas are getting higher. That means we need to do an internal assessment of our organizations.
Mm, mm. So I see you out socially. Like I've run into you at galas and
Yeah.
parties and stuff, but we never really get a chance to talk. But I'm interested in knowing like how do you have downtime? What do you do for fun? What do you do to relax? What do you do to sort of decompress from running a health
I
department?
know. So, let me tell you. So as you know, we see each other socially, as you mentioned, and everything that I have going on. I think self-care is really critical. So I am about balanced living. So I do block out, just like I block out everything else, I do block out time periods for me to be able to rejuvenate. And I'm really big about mindfulness and being centered. So that I can be my best self when I'm out in the community serving the public, and or attending events that are often for a good cause, right? So we're often attending different galas because it's to support different causes that really are all public health related. And so I'm glad that I'm passionate about them because to me, gala is almost also some time for me to socialize. So just like on Thursday, I was out on the dance floor dancing, having some fun, dancing with the mayor and the mayor's wife because we have to also be able to embrace those times that we're sharing with people that we work with because it's a lot of time that we spend with each other.
Mm-hmm. Mm-hmm. Absolutely. Absolutely. Well, I'm glad to know that you are taking good care of your own personal health,
Absolutely.
because women of color, we don't, we're not very good at that in a
Yeah.
lot of ways,
I try to work out. I try to work out. I get my steps in. Where a lot of us here take our steps in. And then for my staff, I incorporate wellness into the office. So we have different massage chairs, nutritionists that come in the break room, so that they also have self-care for themselves. So I try to not only be an example, but also provide resources right at the office so that they can block out time, to be able to take advantage of that.
Oh, that's wonderful. I'm gonna have to
Mm-hmm.
come work for you, Maritza.
Yeah, listen, but I will hold you accountable because listen, when we serve the public, I will hold you accountable. So if you want to operate in excellence, yes, you want to be here.
Well, this is flu season, and you're here to just remind the listenership that this is flu season and that they should take every precaution that is available to them, vaccines and
Yeah.
hand sanitizers and all the things that you said. Tell us one more time what we should be doing.
Yes, so you should come to the health department. If you want to visit us at the Health and Wellness Center, 424 Chapel Street, Monday through Thursday, 9 to 4:30, or Friday, 12 to 4:30. Anyone over the age of 3, you don't need an appointment, just walk in. We got you. You can also go to vaccines.gov and find a local pharmacy near you. If you want to just be able to be close to you, if a pharmacy is on your way to work or on your way home from work, but we're also out in the community. We are, so visit our website at nhv.gov because we are going to be at City Montessori School. We are at the library. We are everywhere. So we are trying to also go out to the community and meet people where they're at. So please let us know how we can also serve you. If there's other things that you see the health department could be doing, shoot us an email, health director at newhavenct.gov, because we also want to make sure that we're meeting a need that we may not be seeing, right? And so we want to make sure that we're serving individuals. And then also making sure that if you are a patient of your community health center, your community health center is there for you.
Mm. Thank you so much, Marissa. I've learned something about you,
I
and
know,
I
I
so
appreciate it.
appreciate that.
It's been a pleasure. I've been wanting to get on your radio show for a long time, so I'm so elated that my team made it happen this time.
Well, I want you to come back. Feel free to come back and use this
Yes.
as your platform. I enjoyed this very much, and if there's some other health related thing or whatever you want to talk about, come on, come back on.
Thank you for extending that invitation. I look forward to staying connected. And listen, if you want to have a conversation over some coffee over divinity school, let's do it.
Yes, I will definitely reach out. Thank you,
All right.
Maritza. Have a good day.
Take care. Bye.
Take good care. All right, Harry Jones. We know what we need to do. We need to get our hand sanitizer over 70%, Harry, and mask if we need it, because I know you're about to have people over at the house for Thanksgiving. I'm coming this year, Harry. I don't care. And I'll see y'all tomorrow. No, no, I won't be here tomorrow. Tomorrow I have to go up to Western New England to say hello to the Western New England Law School, to say hello to them, meet them, talk to them, and let them know I'm still very much interested in their institution. So I won't be around tomorrow. Harry will play the best of. Maybe he'll replay this conversation because it is flu season. And I'll be back on Thursday. Thursday, I believe, Harry, I have no, I don't have a guest on Thursday. Thursday's Halloween. So, we'll have some Thriller playing. We'll play all the goobly gobbly music that we could find. So, all right. Y'all have a good one. I'll be back Thursday.